In response to the alarming mental health epidemic, we have seen a surge of self help application adoption. My name is Nita Akel. I am the founder and CEO of MyAtlas, and I'm here to present a solution that not only innovates self help, but revolutionizes the mental health care system through data and precision care. Our MVP application creates a hyper personalized treatment plan for the user, allows the user effortlessly monitor their mental health, and uses the user's data to provide daily mental health intervention. Let's get started. The core of our solution is hyper personalization, and our onboarding process uses gamification to collect user information. I am going to be showing you a snippet of our onboarding. We use this information to build a digital twin of the user, ensuring that even a Nigerian American immigrant like myself has a total unique and personalized wellness experience. We start off by asking demographic questions that aim to understand the cultural factors that may underlie mental health symptoms and behavior. We then ask wellness questions that give us insight on how to classify and evaluate user behavior. The questions range from asking what the user's wellness goals are to finding out if they're a night owl or a morning person. Based on the user's responses, we can tell their focus areas and then probe on even more questions. So in this case, we have identified that anxiety reduction is a priority for the user and would be focusing on stress and sleep reduction. To this end, we ask more in depth questions like if the user has had any physical conditions or if the user works remotely. This process was put together by a team of neuroscientists to ensure that it models the intake questions that are typically given at brick and mortar wellness establishments. And yes, it is important to know if the user drinks coffee. Lastly, we asked a set of personality questions. This dictates how we interact with the user and what interventions are offered to the user. Our goal is to make the interventions effective and actionable, so we would hate to tell someone who is not so sociable to go to a concert in order to de stress. The last part of this process is connecting health data, and this is our secret sauce. We are able to access data from multiple wearable and digital devices. While connecting digital devices and Apple Health is not necessary, it does fill our database phenotype analysis and wellness metrics. Once the onboarding is completed and a program is created for the user, we then personalize this program to each user. So every user is getting a different app. This user is going to get an app more catered to relationships and stress. My Atlas is effortless care. The user gets a notification daily that recommendations are ready, and this is then given to them on the home screen. This user has been sleeping fewer hours and is showing symptoms of anxiety. We have recommended that this user should invite a friend for coffee and take a walk to the class rather than taking the train. These recommendations are formulated dynamically through our patented biofeedback recommendation system. The user also has access to all the data we collect and gets insights on what they are feeling. These data points are the output of another patented technology we have that transforms health data into mental health metrics. The aim is to use this data to inform mental health habits and then ensure an effortless app experience. We aggregate the data into scores so the user can simply open the app and view what domains of their mental health needs more help. Is it relationships? Is it physical health? Is it stress or is it sleep? The visibility into their mental health has been proven to increase self care behavior, similarly to how fitness trackers incentivize fitness activity. Based on the user scores, we then give recommendations. So if I have a low score in stress and relationships, I will dynamically be giving recommendations to those on the homepage. This emphasizes our biofeedback recommendation system and allows a more precise self-help intervention process. Lastly, we have built an AI coach that uses all the information gathered here to guide self-help care. Thank you again, and